Hello friends, welcome to TechQuest channel. This is for the medical technologist by your medical technologist. Watch my videos for blood test and interpretation of results. These videos are made for you. In this video, we will discuss about the hematology investigations and how to confirm or correct the abnormal values. When you see abnormal results that may be lower or higher than the normal, always check other parameters to confirm the results or to reject the result. To start with, hemoglobin. When hemoglobin value is high and other values are normal, check for Rbc count. Usually Rbc count is million multiplied by 3 is hemoglobin result in grams per dl, and PCV divided by 3 will give approximate hemoglobin level. When the Rbc count and packed cells are normal and hemoglobin level is high, please check other samples run by the same instrument. If many samples are showing high hemoglobin levels, that means there is an issue with the instrument itself. If only a particular sample is giving high hemoglobin level, the common cause for high hemoglobin is lipemia, creates a turbid sample that may interfere with spectrophotometric method of hemoglobin concentration. Lipemia will falsely increase the hemoglobin levels, and since the calculations for MCHC uses this value, it will also be increased. Yttric sample also give a little increase in the hemoglobin level. Please check the sample for any lipemia or turbidity in the sample. Low hemoglobin levels. Severe hemolysis can cause a decrease in hemoglobin levels and packed cell value. As the hemolysis also causes low Rbc count, the Rbc count and absolute indices are proportionately decreased. A microclot can also give a low hemoglobin level if they are removed immediately after sample collection. A major clots are normally detected while checking the sample before loading into instrument. A small clots can also alter the Cbc results if they are unnoticed. Samples collected from IV intravenous catheters lines can give diluted with infusion sample. Whenever possible, sample should be collected from the arm opposite to the line to avoid contamination. When vascular access is limited, the sample may need to be collected from a line. Before collection, the infusion fluid should be stopped for several minutes and an amount of blood equal to 3 or more times the dead space of catheter should be discarded before collection. Whenever the sodium is less than 130 milliequivalents per liter and chloride is less than 100 milliequivalents per liter and potassium is more than 5.5 milliequivalents per liter, suggests there is a contamination in the sample. When the glucose level is more than 800 milligrams per dl and creatinine is less than 0.6 milligrams per dl, also indicates there is a contamination in the sample. Sodium more than 180 milliequivalents and potassium less than 2.5 milliequivalents per liter suggests there is a intravenous fluid contamination in the sample. The chemistry lab should immediately inform other sections to alert the improper sample collection. A delta check also can indicate the shift in the sample result if the previous sample was done. Decreased PCV in manual method. Increase in EDTA in the sample can cause the shrinkage of RBCs and gives low packed cell volume in manual method. In the peripheral smear, EDTA shrinkage can be noticed easily. Low Wbc count. If a sample has a microclot with leukocytes trapped in it, can give a low Wbc count. Leukocytes clumps are also cause the low count, as Wbc clump is counted as 1 Wbc in the instrument. High Wbc count. Microclot or platelets or platelet clumps are counted as Wbcs in the instrument and can cause a false high Wbc count. Please check the peripheral smear for platelet clumps, and often they are located in the periphery of the smear. Low platelet count. A microclot in the sample or a fibrin clot can cause platelet for low platelet count. A microclot in the sample or a fibrin clot can use the platelets for clot formation, give low platelet count. Sometimes it is difficult to identify, and this fibrin clot can block the sample aspiration probes in the instrument. EDTA-induced platelet clumping. Normally occurring alloantibodies directed against platelet glycoproteins 2, B, and 3A. Infectious mononucleosis, cold agglutinin disease, multiple myeloma, liver cirrhosis can cause EDTA-induced pseudothrombocytopenia. Platelet satellitism is the adherence of platelets to neutrophil surface due to the surface IgG antibodies directed to the glycoprotein 2B or 3A complex in platelets. Presence of giant platelets can also give a low platelet count quantitatively. Please check for microclots or fibrin clots in the sample. Look for platelet aggregates in the periphery of the smear. Manual platelet count can be done. Smear or using heparin or citrate as anticoagulant can be used in EDTA-induced pseudothrombocytopenia cases. High platelet count. A false increase in platelet count are seen in hemolyzed samples as the broken RBC debris are counted as platelets. Please check for sample hemolysis for the correction. Iron deficiency anemia also can cause high platelet count. Normal iron level is important to maintain the normal platelet count. Decrease in iron level causes increased platelet count. NRBCs in the smear. Nucleated RBCs. Presence of nucleated RBCs in the sample give inaccurate Wbc count, as these NRBCs are counted as Wbcs in the instrument. Please count the NRBCs during Wbc differentials and make correction in the Wbc count if the number of NRBCs are more than 5 per 100 Wbcs. Take extra care to differentiate NRBCs from small lymphocytes. When the NRBCs are present in the sample, the reticulocyte counts are always higher than the normal, as the immature RBCs are in the circulation, and polychromasia is increased in the peripheral smear. The immature RBCs cause polychromasia in Romanesque stain. Thanks for watching. Please watch, share, and subscribe my channel. If you like this video, we will make more videos on correcting the values. Thank you.